Good Friday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness at Knox County Health Department. Our moment of gratitude today is dedicated to child care operators in summer camps that are open and following the guidelines. These places are critical for so many families during the summer months as parents continue to work and keep our community and economy moving forward. We are grateful for their commitment to keeping the children in Knox County safe and entertained. We also respect the decisions that some summer camps and child care operators made to not open, as they decided that was what was best and safest decision for their business. And we are grateful for them as well. Moving into our local situation, we have 460 confirmed cases of COVID-19 in Knox County. Additionally, we have 11 probable cases. 363 of our cases have recovered. 44 individuals have been in the hospital at some point in their illness, and one Knox County resident is currently hospitalized. And we are thankful to report that we have no additional deaths from COVID-19 complications. Now our transition to the benchmarks. As a reminder, for the majority of our benchmarks, what we want to see is no 3-day statistically significant shifts within a 2-week time period. Every day we look back at the previous 2 weeks. That's what a rolling average is. Overall, what we mean by this is we are trying to see if things are staying the same or are they getting worse, and if so, how much worse. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. This week, we again experienced a 3-day statistically significant increase in new cases. These increases caused us to keep this traffic light as red. While we have expected an increase in our cases as our community continues to reopen, this increase in new cases is concerning. We want to stress to our community that this virus is still very present in Knox County, and we continue to stress the importance of the 5 core actions. There could be several reasons behind the increase in new cases, and we continue to investigate. There is more opportunity for testing, more people are out and about as our community continues to reopen, and we've identified several clusters. Once again, we want to emphasize that identifying clusters is something we expect to do and is standard part of the public health response. Clusters have been identified across the board in workplaces, social events, and other gatherings. Again, following the 5 core actions can help to prevent new cases and clusters. So that's social distancing, wearing a cloth face covering, washing your hands, staying home when you're sick, and frequently disinfecting surfaces. What we want to see moving forward is the new cases becoming more stable and leveling off. Once they level off, the rolling average shifts, and we no longer see a sharp increase in cases. This will allow us to potentially ease back into the yellow or the green traffic light. This is something we will continue to keep our eye on as we move forward. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we are utilizing 2 bar graphs, one that shows a sample of the test conducted for Knox County residents and another for the average time between specimen collection and lab report data. What we want to see is the amount of testing staying the same or going up, and laboratory reporting time staying the same or decreasing. Based on the qualifications mentioned, for a shift in traffic light colors, this benchmark meets the qualifications for green. Our third benchmark, sustained or increased public health capability. This chart shows the number of individuals currently on the epidemiology support team. Last week, we expanded our team and added additional interpreters in order to reach out to our community members whose first language isn't English. At our current number, we are able to effectively perform our contact tracing and investigation responsibilities. Because of that, this benchmark meets the qualifications for green. Currently, we look at KCHD staffing capacity in evaluating this benchmark. However, moving forward, we are looking at how we can refocus this benchmark on the time it takes for our team to make contact with cases, so that the effectiveness of this benchmark is based on the time it takes to reach out to cases as opposed to our staffing capacity. As we mentioned in the reopening plan, we aim to reach out to cases within 24 hours and close contacts within 48 hours. To date, throughout this pandemic, we have accomplished that for all of our cases and contacts. We are looking at how we can demonstrate this benchmark in this way moving forward. Additionally, due to the expected continued increase in individual cases and clusters, we are working to expand our team even further. To put this increase in perspective, before the community reopened, each case only had about 3 close contacts. That's because they weren't really going anywhere for the most part. The cases were staying home and maybe running only a few essential errands. Now, as the community reopens, cases may have 3 to 15 or even more close contacts. Our team is responsible for reaching out to every close contact and providing daily check-ins to determine if they develop symptoms. Just last weekend, our team was checking in daily on more than 700 close contacts to cases. Our fourth benchmark, healthcare system capabilities remain within current forecasted surge capability. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and the patients with pending test results in the hospital. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, East Region, or patients from other jurisdictions. For this benchmark, the traffic light does remain green. While we did experience a few days of statistically significant increases, as we stated previously, because the number is so low to begin with, even a small increase registers as statistically significant. As always, decisions regarding how to classify this benchmark as green, yellow, or red are made in concert with our hospital partners, as well as taking all of the data into consideration. However, we do want to note, while the numbers of COVID patients in the hospitals are relatively small, they are continuing to trend up. We are watching this very closely. It again demonstrates that the virus is still present in our community and impacting our neighbors, which is another reason we continue to recommend and encourage the 5 core actions to reduce the spread of disease. Our fifth benchmark, sustained or decreased COVID-19 related death rate identified positive or probable cases. For this benchmark, we show the chart that details cases, hospitalizations, and death. This benchmark remains green because we thankfully have not had an increase in deaths. And now we'll open it up for questions.
All right, please go ahead and submit your questions into the chat feature. And please remember to type in your name and the media outlet that you're associated with. All right, from WVLT, Megan asks, does the Knox County Health Department consider remdesivir as a viable treatment option for local COVID-19 patients?
That is in the recommendations at this time for potential treatment. I would suggest you talk with our hospital and healthcare partners to get more information on that, but it is one of the potential medicines that could be used.
Her follow-up question is there any evidence it can work to prevent an infection, and what do citizens need to know about this medication?
Again, I would suggest you talk to one of our medical providers that would be utilizing this. I think it's more for treatment than for prevention at this time. There's a lot of different studies going on, but I wouldn't try to do it in advance to prevent the spread. At this point, the recommendations are for treatment.
From Jim with WBIR, he says, I know this is requesting a simple answer to a complex question, but many people have asked us simply, are we really seeing a relative increase in COVID-19? They may tend to attribute the rise in overall numbers to an increase in testing. Do you mind explaining the measurements you use, such as percentage of tests that are positive, and help us answer the common bottom line question, is it spreading more, /faster, /worse?
I appreciate the beginning of that question because that really is a very complex question with a very complex answer, and I'll try to make it as simple as possible. What we are seeing a statistically significant increase in new cases, but that can be attributed to a lot of different things, as we mentioned. But the data does support that they are going up. We aren't doing percent positive of cases, just because, as we say in our data as well, we don't have the firm denominator for the total amount of cases that are our tests that are being completed in our community right now. What we have on our website is a sample of what we feel confident in the data that we're presenting, and that is a sample of the data. We know that there's more tests happening in the community. So we want to encourage people to see this as the number of cases are increasing. Whether testing's increasing or not, we're still getting more cases in the community, and we need to continue to take that seriously. So it's still there. People still need to follow all the same guidelines we recommend to prevent the spread of disease.
From WATE, they ask, we know you can't discuss specific cases, but can you tell us anything about a potential exposure situation with the Farragut High School football practice? The school system shared with us an email to parents saying that such an exposure had occurred.
I can't speak about, we don't speak about potential or specific cases or clusters, but I can say this: we have seen an increase in cases in the 11 to 20-year-old demographic in general. I think we've had an increase in 15 cases in that group this week alone since Monday, and that's concerning. And so what we say is, again, this virus is out there and it's present, and we really want people to follow the guidelines. When you're in social groups, it's really hard to stay 6 feet apart, but we need you to do that. We need you to be wearing masks and washing your hands frequently and doing all of those things that we're asking, and limiting the social interactions that you have when you don't have to go out and about. It's all very important, but we are seeing an increase in that age group. And we want people to know that and be aware of that they can get this virus as well. And either they could have consequences, or their loved ones can, or their neighbors, all of those things. So please, again, follow the recommendations that we provide.
From Megan with WBLT, is there any research that shows what factors have contributed to Knox County's relatively low hospitalization rate?
I don't know of any research that's being done on that at this time, but we're happy that it remains low, and we hope it continues to do so. Don't know of any research right now.
Any other questions? Please go ahead and submit them into the chat feature now. From WATE, are you concerned about health impacts of protests?
As we said before, anytime there's large groups of people getting together, there's potential spread for this virus. And so there is concern. And if you've attended protests and you're concerned about potential exposures, we encourage that you get tested. And if you're attending ones in the future, that you try to do your best to follow the guidelines there as well. So trying to stay 6 feet apart, wearing your mask, washing your hands frequently, don't attend if you're sick. All of those things are very important in these instances, as well as all other.
All right, any other questions? Please go ahead and submit them into the chat feature now. Also from WATE, what can you tell us about the phase 3 discussions at this point?
At this point, we're looking at data and looking at the benchmarks for this week. And as we said, there'll be more information next week on the phase 3 portion of the plan. But our benchmarks right now, a lot of them are doing well. The new cases we're concerned about, but we hope that they level off and stay at a manageable level. And we'll have those discussions into next week.
All right, I'll ask again. Any other questions? Please go ahead and submit them into the chat feature now. All right. From Brian Hornback, he asks, has the Reopen Task Force meeting been set?
It has not been set yet, and we will get that information out if it does. I don't know. I'm not on the task force to be able to give you more details.
Any other questions? Please go ahead and submit them now. All right, since there are no other questions that are being typed in, we'll go ahead and end things for today. Thank you all for joining us, and we hope you have a great rest of your day and a great weekend. We'll see you on Monday.